Hi, Dr. Pelto here. This is specifically a video to help train scribes with physical exam or diagnosis findings. So specifically, I'm going to talk about how to document X-ray findings and how that relates to physical exam findings. So I am going to use I'm going to share my screen and use a test patient here. So here is an example of a test patient that we're going to use for this. When we talk about physical exam findings, there are a number of findings that we can use. I'll give you an example here. This is just a foot pain normal template. This is normal findings. And when we're looking at an X-ray, we're going to specifically be looking at musculoskeletal because that's where the bony deformities show up. So for example, you might have something called pes cavis, which is a high arched foot. You may have something called pes planus, which is a low arched foot. You may have a prominence. You may have something called a Taylor's bunion, which is a bump on the outside. You may have hallux valgus, which is a bump on the inside. And then you also may have either claw toes or hammer toes. You could have a hammer toe, the great toe, second toe, third toe, fourth toe, or fifth toe. And so specifically what I want to show is what happens is when we see a patient on the physical exam, we put in there what they have. If it's a bunion, if it's a hammer toe, if it's a painful metatarsal head, what they have. And then in this area under the assessment and plan, we put in the diagnosis for that condition. And then many times we're getting an X-ray, and this is specifically what I want to show. So on an X-ray, you are going to choose right, left, or bilateral. And then you're going to choose if there's no evidence of bony abnormality. That's very rare. Most of our patients have something going on. And then you're going to document the bone density usually is normal unless they have some type of osteopenia or osteoporosis. Bones and joints are well aligned. Sometimes they have this, but most of the time we click this button. Soft tissue is usually within normal limits unless there is a lot of swelling. And then for children specifically, we say if the growth plates are looking fine. Okay, that's the first. This is kind of the normal findings. Now we get into all the pathology. Within the physical exam findings, you're not going to put in that patient had a fractured, for example, fifth metatarsal. You're going to put that the patient has swelling on the lateral side of the foot. That's what you're going to put in pain to the fifth metatarsal. And then in this area, you're going to have to document all these findings.